why internal medicine? So, long story, but short story is that I've always wanted to become a physician since I was a child. And one of the first people I was admired by was my pediatrician. I thought he was like the coolest thing, and I wanted to do everything that he did. And I remember like walking out of the office and telling my dad, I'm gonna be a doctor. And then I did basically everything in my power after that to be a doctor. So I was in elementary, junior high. I did what they call candy stripers back in the day. Not trying to tell my age, but basically it was voluntary at the hospital, at Cook Children's Hospital. I volunteered for like 2 to 3 summers. And then after that, I went into pre-med programs while in high school, like getting prepared to study for biology, getting prepared to study pre-med biology, doing those kind of things. And then after that, I got to college. I was pre-med biology major, minor in chemistry. Each summer one summer I did summer school. The other summers I was an internship. So, and that was SMDEP. I did after I had the unexpected gap year. I did an internship at University of North Carolina Medical School. I did research. I did scribe. Then I got into med school. And during my gap year, my uncle, which we already knew had multiple sclerosis, we were like the primary caregivers. My father and my mom, my parents are basically the primary caregivers of my uncle during my gap year. And during that time, it was just really hard seeing him getting like more and more sick, multiple hospitalizations, multiple office visits. But I was able to see from internal medicine perspective about how important internal medicine is for adult medicine and how integrative it is in an outpatient and inpatient setting. Because internal medicine is so vast in regards of adult medicine. There is a teamwork, and coming from a sports background, that's what I really liked. I like that there's an internal medicine doctor who is able to pull from other people, especially in the inpatient setting. Not that you can't do it in outpatient, but especially from an inpatient setting in which you can have everybody put their heads together to make someone's life better. For example, through an MS flare, you have infectious disease, you have, of course, the internal medicine, and sometimes you have intensive care depending on if they're having crisis or something along those lines. And you have neurology. You just have so many people being able to put their heads together for one person to make their lives better. And I really, really liked that. So from a patient's perspective and a family member's perspective, I was able to see it, how important it was. And when I tell you, when I got to 3rd year, I did a 12 weeks internal medicine block, and I absolutely loved it. I loved it. I love the different kind of cases. I like going from heart failure. I like going from AKR. I like going from, okay, this patient needs to be intubated and transferred to the ICU. If it was a hospital that was open ICU, you would still be able to manage that patient in the ICU. If you still needed additional help, like this patient has endocarditis, we need to get infectious disease, we need to get cardiology to get a TEE, we need infectious disease for antibiotic regimen, we would do this. It's like the amount of knowledge, the amount of things that you get to see as an internal medicine physician. I loved it. And I want to be a part of that. So, what did I do? I said, hey, during match season, I'm only applying to internal medicine, and that's it. If it's not internal medicine, I'm not going anywhere else. So if I don't get it, I don't get it. I'll have to apply again. So I applied to internal medicine, got to my first choice, and I'm loving it. Don't regret it. And yeah, so we'll see where I end up going. But I say anyone that's going into medicine, figure out what you want and the reasons why you want to go into something. and that's going to basically allow you to hone in on when there's the hardest of the day, especially during residency. You remember why you're there in the first place. So do what's best for you and figure out what you really, really like doing, what you can see yourself doing for years. Because, honey, if I didn't like it, I would not be doing it. So I wish everyone the best, and I hope you join the best specialty in the world. See you guys later. Bye.